the rest of our panel. Thank you.
And now, the Chicago Bulls. Is this? No? Can you hear me? It's always interesting when you ask, can you hear me? Because if you can't hear me, what would you do? But anyway, okay, I'm going to introduce our panel. Leading off, Amanda Sitkor from AstraZeneca. Second, Donna Judd from Pfizer. Okay, now, I just asked Vimal, how do you say your last name? He gave me a different name than was on the sheet, so, because he has multiple names. Aliases is what we would usually refer to him as. Vimal Kumar from his own company called, let me get it right, Medtrix Healthcare. And now the man in the middle with our analytics, Sean McKenna from, how do we say this? Corrects Pharma. Got it. All right. Okay, so we're going to talk about personalization. I've given each of these guys one question for each of them to address. I would encourage you all to challenge anything that any of these people say. I've known them for like 10 minutes, so like challenge anything they have to say. Before we go any further, I did remember anything they say is their own opinion and not reflective of the pharma company, or in my case, high school tennis team that I work for. Okay, so you guys are good with that? You're clear now? You can say whatever you want. Okay, cool. So if there's any lawyers in the room, we're good. We're going to start with, the topic is personalization, and it's a seemingly interesting who's against personalization kind of topic. And I learned this early on in my career. There are certain things that the faster you say them, the better they sound. And then when you think about it, I think personalization is one of them. It sounds really good. I'm not sure it is, but I'm anxious to hear what these guys have to say, because they have very different areas of interest in personalization. And we'll hear kind of how they're using it and how they're not. And then after they talk, we're going to then talk about what exact data we're going to use in personalization, because we're going to talk generally about personalization, but then what specifically do you need? And in our call, Vimal was very clear in saying we want this to be a specific information kind of session, not generic. So I'm going to hold you to that, okay? All of you guys. So, and call us out on it, because it should be useful. That's the whole idea. If you're not doing personalization, why not? If you are, and it's working great, tell us about it. I'm guessing it's not. It's a lot of effort, a lot of cost for a little return. That's just my opinion. But we'll hear what these guys have to say. So we're going to start off with Amanda. So Amanda's an omni-channel marketer. So where does personalization fit in your planning?
Yep, thanks, Jim. So personalization is really foundational when you think of omni-channel strategy. You can't build a customer-centric, connected experience without some level of personalization, right? That level of personalization, of course, is going to vary. When we think about the planning process, I think regardless of if you're talking to HCPs or patients, it's always going to start with knowing your customer, right? So understanding who that customer is, what are their needs, what are their behaviors, what are you trying to get them to do, right? And so with that deep understanding of the customer, you kind of have that foundational layer, and then you can apply personalization in a purposeful manner. So thinking about how you apply that, I like to think of it in 3 buckets or tiers. You have your broadest level, right? That's broad reaching communications. So say you have a new product launching, you have a coming soon or a now approved campaign. You might have nephs and cardiologists on your target list, but those banners and those now approved and coming soon communications, you don't really need to differentiate them, right? Like your message is limited. Everyone just needs to know the same main point, right? Then the next level down, you have audience or segment level personalization, and that's thinking of your role, your specialty, where you might be on the adoption journey, right? So you have new data coming out on comorbidities of hypertension, for example. you want all of your HCPs to get this data, but you're going to want to probably tailor your subject line for your nefs versus your cards, right? You're going to want to change the modules in your email, so maybe a certain part of the study is up higher for your nefs versus for your cards. They're going to care slightly about different things. You want them all to see that study, though, right? And then lastly, the deepest level is that behavior-led and consent-led personalization. So think of that as the closest thing we'll get to one-to-one personalization in pharma. So that's really based on individual data and signals that that HCP or patient is providing you. So HCP comes to your site, he accepts your privacy policy, he engages with your efficacy content deeply, and then that signal can be sent to your sales rep, right? Sales rep details the HCP, they talk a little bit about efficacy and dosing. We know from other data signals that that HCP might have a affinity for face-to-face and digital combined. So we're going to follow up with an efficacy rep-triggered email. And then later on in a couple weeks, that HCP is going to see that dosing message, right? Or the next sequence in that dosing message. And so I think it's important just to remember that regardless, it's going to vary, right? It's going to be some type of a combination of those three tiers, but it's really going to vary on your audience, the data signals that you have available, and the strength of that data.
Okay, so let me ask you about, it sounds like the middle tier is more customization than personalization.
Yeah.
Different specialties get different kinds of messages, but they're basically, a pediatrician's different than a family practice, right?
Correct. And I think it's still personalization, it's just not one-to-one per se.
Okay, so what channels do you use? You're on the channel, that means everything. It's everything to me.
Yep.
It's all channels, but like, how do you work that personalization across channels? So
it's really going to depend on the data that we have available, right? Different channels, especially on the HCP side versus the patient side, obviously we have a lot less availability of data and targeting and knowing who our patients are versus on the HCP side. But I think it's important to also remember it's not about having like the most personalized assets or personalizing in every channel. It's really more important to think about orchestrating seamlessly across all of the channels so that every touch point you have with an HCP or a patient, it feels like we really know and understand the patient or the HCP and really understand their needs.
Okay, so I take that as it's almost impossible to have personalized messages across all channels.
If you want to do it right, yeah. I mean, you could do it, but you don't want to do it for the sake of doing it, right? It's about where is it going to add value.
So don't put that on your objective. So then you're just like, okay, did it. No matter how crappy it is,
yeah.
Just did it, right? So Sean, I'm going to ask you a question from the analytics standpoint. Have you had any experience or know of any situations where an analysis of like analyzing customers' behavior will lead to personalized messaging? You know what I mean? Like, it's not just did they open the email, but like you see a behavior trend in declining sales, or something that would suggest to the marketing team we can address our hypothesis as to why that behavior is happening. You ever done anything like that?
It's really easy for me to point stuff out to them on what I think is happening, but at the end of the day, the advertisements that we can put out, as you guys are keenly aware, whatever you want to call it, PRC or MLR, the advertisements are going to be driven by what you can say in a regulatory fashion. So my company works in obesity. Unfortunately, I can't do what Roe, hims and hers, Willow, you guys name them, can do, right? Because they are in the Wild West. They can instantly put out the ads that are hyper-personalized, like you're talking about. At the end of the day, the unfortunate reality is no matter how cool or neat or personalized or whatever signal we think, we're always going to be governed by the content that the brand team can put forward in an MLR through the FDA, because we're pharma companies. And that super, in my opinion, super duper limits the ability to hyper customize things. You got an efficacy message, safety message, dosing message with slight variations. basically, right?
You could do those with your eyes closed, right? I mean, that's like, yeah. So the challenge, I think, is for Donna and Amanda to try to figure out how do you get this through MLR, right? Because it's, one of the things I learned over a lot of time in pharma is the marketer has more power than they think they do. Our senior legal guy in vaccines told me one time, I don't make decisions, I give counsel. I inform you guys of the risk. Whether you want to take that risk or not, that's up to you. So if you're going to say, look, I'm going to look at this customer's data to create this message because I think it's worthwhile, and they say, well, they didn't sign off. It's like, okay, what's the weight of what's the trade-off of the risk of that resulting in some sort of lawsuit versus the benefit to these customers who are now getting a more relevant message? So that's a challenge for you guys to take out of here, right? And we'll report back next year on how it goes. Okay, good. We'll make a note. Where's Simon? We'll make a note of that. All right. Okay. Next question is for Donna, and Donna's in medical channel strategy, right? Did I get that? Medical.
Right. That's right. Yes.
For Pfizer. Yeah. And the question is, what are the limits and opportunities in personalization for medical versus commercial?
Yeah, so hi everyone, I'm Donna, and my team supports the end-to-end strategy and execution of how medical affairs utilizes channels to reach healthcare professionals. So I think the patient angle is another whole can of worms, but some of my comments are really more focused on the healthcare professional. And I think that medical affairs and marketing are much more alike than they are different. And I think in this new world of data and analytics that we have available to us, this is to our advantage. But I will say a limitation in medical affairs is that we do not have the data infrastructure to support personalization, just like what you heard Amanda talk about. We're getting there. We're recognizing that we can input different data sets that actually do reinforce our strategy appropriately in medical. And there's a lot out there, but they're all disconnected, siloed. We can't operationalize them, and I would say we've now recognized that as an organization and tried to incorporate medical into things that the marketing teams are doing in an appropriate way.
That's not just medical, right? That's like,
well, yeah.
Every pharma company has that.
Sometimes I've noticed that we're not even part of the conversation about how this would be a need for us. So that is changing, and I think that's a good thing for patients. But I would say that the way that we use data, although the data sets might look similar, we also use different types of data sets. And we also, we look at things differently. And I would say the opportunity is that looking at things differently. And we were just talking about behavior changes. The way that we look at building audiences in medical affairs is often it's much more patient-centric, I would argue, than the way that marketing has traditionally done it. So marketing tends to think of audiences from top down, market share, prescribing volume, whereas in medical affairs, the approach we've taken is kind of a bottom-up. Who are the patients that have that gap in care? And then building that up to who are the healthcare professionals that need to hear the message that will influence that care and optimize patient outcomes. And that in itself is a way that we've made this information more relevant to healthcare professionals in our communications. And we've actually seen great engagement, even versus what marketing may be doing in that space, because we're able to hyper-personalize what that HCP needs to hear.
I was going to ask you, was it more customized or personalized? But you just said very hyper-personalized.
I think it's a combination of both, and I think that the level of data integration that we're able to do now, at least in medical affairs, is not at the level where it's more of a piloting. Will this make a difference in engagement? But I think that next year at this time, I'm hoping we see something that's meaningful. Well,
you'll be on here explaining where you are, so that's good. What progress have you made in the last 12 months? Okay, thank you, Donna. Let's go to Vimal with you're sort of representing the tech side of this, fairly or not. You're the guy. So what technology advances are there in personalization that will make this concept easier to implement? And now this is going to go to one of my favorite topics of efficiency and effectiveness. Being more efficient is one thing, but I really would love to know about making it more effective. So what do you know on the tech side for personalization?
Yeah. Thanks for that, Jim. So I actually run a company who's a content partner, so to pharma, big pharma, small pharma. So the way we see personalization and how technology can play a role in that is that first and foremost, we try to fit into the whole mix of how this can be managed, right? So in my opinion, everything comes from what you want to achieve. Donna mentioned about commercial versus medical. In our experience, we feel that medical has more leeway to express content because of not needing to get restricted to the prescribing information, for example, right? So there is a much more freedom to represent science as a medical organization, for example. So going back to the technology, we actually start with where the strategy is, what are the objectives, and then the content drives the whole mix. It's not the other way around, not the technology drives content. Content drives what kind of technology you need to adopt, right? So, for example, some of the experiences that we've been having, especially with smaller pharma, is that they have resorted to bite-sized content. When I say bite-sized content, it could be a small video, it could be a game, it could be another intelligent intervention. At the same time, keeping in mind that we always want to respect the intellect of the customer, who's the doctor, who's probably one of the most intelligent persons in the society. And the content will then, once we have the strategy, then we look at what kind of insights we can build into the tool, and the content pieces are developed based on that. And then we typically advise different kind of channels, be it Congress, be it anything else. But the important thing is that we cannot miss anything in the whole conundrum to make sure that the technology works. Otherwise, as we say, I mean, you can build the Taj Mahal. Otherwise, if nobody's going to come and visit it, it's of no use. So we can have the best of technology, but the key is going to be how you can make the right fit into the conundrum of how the content is represented. So the trend that we see is bite-sized content. So that's the thing that we see, because the attention spans are very, very, very little. We saw about AI taking jobs and everything. So one thing is clear, that nobody wants to see anything which is more than 20, 30 seconds. So anything that can help you to keep hammering content in a very bite-sized fashion, at the same time tickling a certain level of intellect, is what we adapt.
So I have a challenge to the attention span theory, which is kind of where you're going to. Like, and I'll just ask everybody here, how many of you binge watch anything on Netflix or in the last month or two, right? And so your attention span is pretty good for that, right? It's, I watch a show, then I'm gonna watch like 5 episodes because it's so good I can't turn it off. That's like hours of attention for people who allegedly have an attention span of a goldfish, whatever that means. I've heard that one. So I think the key to that, of course, is that it's interesting story.
Correct.
If it's not that good, you're in and out quickly. I'm not suggesting that any pharmaceutical company can create 5 hours of content.
You can also ask, how many of you binge watch content in LinkedIn? Nobody.
Yeah, right. But that's right. But the point, though, is our attention spans are governed by what we're watching or what we're reading. Donna, go ahead. You're dying to say something.
I am dying to say something. Yeah. I think it just reemphasizes the point of fit-for-purpose content for the channel. And I think in my world, we've had a little bit of an argument, let's say, a healthy argument about what should drive, should content come first or should the channel mix come first, right? Because if you don't know what channel you're putting something on, the content may not be fit for purpose to reach the healthcare professional in the right way on that channel. And right, if it's not bite-sized or if it's too long or whatever, it just does not work. So, but I will say that in thinking that way, what channel we're using and what content works well on those channels, we've seen healthcare professionals watch our videos for a minute, and that's the average view time. So it has to do, I think it's a combination of both. I agree with you on LinkedIn, social, you need the fit for purpose content, but there are channels that can support that longer, deeper engagement.
So you hit one of my favorite topics, which is media and creative, the mix of those. The context matters a lot, because the same ad running on TikTok isn't going to be as effective as on TV or whatever. You know, you have to understand the context, even within the editorial environment of that show. Like if you're running on a drama on TV versus a comedy, it might even be different. You know, so there's a lot of ways to go there. So I just don't want us to assume people don't pay attention. I mean, half the room in here is on their phone right now, so we may have lost them a little bit, but that's all right. We'll get them back. We got analytics coming up next, so that's going to bring the house down with that. Speaking of that, Sean, let's go to analytics. What do you think the question's going to be? Have you measured the impact of personalization? How do you do it? How hard is it? What do you see?
Yeah, I think the first comment I'll make is I'll be the first to admit. So measuring an omnichannel like personalization thing at like an overall totality level is pretty not that hard, right? There's match it, test control in you can do one group of people and another group of people on the program overall. I, as a person who literally it's my job, I have not seen, nor have I been able to pull off, and I think I was pretty consistent with a group here in the room who I spoke with the other day, that as it gets more complicated, I don't think I've ever really seen a very good way to prove to me that super duper personalized stuff at a ridiculously granular level is worth the squeeze. I have not seen it. I'm a statistician by training and a data scientist. I went to a bunch of fancy schools and I've been doing this for a while. I will out-statistic any person in this room, and I don't think I've seen that like a very rigorous way to do it. It seems to me to be a lot of like keeping up with the Joneses. Like in theory, this might sound weird, but it will maybe resonate with a few people. Like post-script, there's something called first-time fill rate, or like time to fill, like how fast you deliver a script to a person, right? And most people are like, for pharmacies, they get benchmarked on that, like within 3 days. And then you get these numbers that are like, well, we do it within 2.5 days. We do it with 1.5. And it's like, that really doesn't matter at a certain point. If folks get their script pretty quickly, it's a good outcome and fantastic for people. In the personalized aspect, the reason I bring that analogy up is because as you personalize it more and more, I've yet to see, 100%, if anybody out there can prove to me that personalizing stuff to a ridiculous degree results in a greater commercial outcome, or for our Med Affairs people, a greater visibility or reading of articles, because you probably can't be commercially measurable. I'm all for it. So on an overall basis, measurement is usually done in match, test and control. I'll use Shapley, in case people know Shapley, to be ultra nerdy. That's changing R-squared based on predictors, what some people see, what some people don't see. You can do some random forest stuff to see like variable importance and ranked importance. But I have not seen, nor have I seen a very statistically rigorous way of ultra-personalized resulting in a more and beneficial commercial outcome when you weigh in the fact that it probably took the individual from Biogen was on the stage, and she said yesterday, 14 months at Biogen for personalized content. That's 14 months of time and money.
How'd she get it done so fast?
Yeah.
I mean, if anybody can prove to me that super duper personalizing beyond, say, level 2 from Allison, which I really do like level 2, and then what you said, Donna, on like customized content, right thing for the right channel. Yeah, I'm all there. But like getting like even niche, carving us into 30 groups and delivering different things to us, that's insane to me, and I haven't seen that benefit.
So is it possible to structure like an A/B test? Some get personalized messages, B doesn't get personalized. Is that sounds like it's easy to draw up on a whiteboard, but hard to implement?
Yeah, but then like, which personalized message was it within the group that did better than the other group? Oh, then what was the order of the message that they saw? What was then the message that followed it? By then, your degrees of freedom, so the variables that you're measuring to see the result, is becoming so sparse that you're basically making singles ads for people. That you're like, you really like this, and then this, and then this, and then dinner, and then an Aries, and then you saw somebody, and then you wrote a script. Like, it's insane once you start measuring all it down. So A/B works simply, but not super.
Yep.
So,
Just one more point to add to the level at which you can personalize, right? So what you could one thing which we are seeing regularly is that personalization and is on one side. But then for that to really work, there has to be speed. I mean, the speed is part of it, because we have already created systems and process where, for example, a simple example, let's say you have a website, right? We have a medical affairs website in an oncology indication. So what we have done is about the content updates, not just the personalization, right? So the site has a direct conduit to the CRM, and it can pull content from the CRM almost instantaneously as and when it is updated. So you don't need to really go in and update every time that you have something in Viva, you pull it out and put it in your channels, for example. So we've automated it. So it's instantaneous, so you don't need to really worry about it. So the content is relevant and top-notch, and that is like as early as today, approved as early as today.
So to combine what you guys have both been saying, to me, I agree with personalization, at least in my experience, almost no impact. A lot of time, some money, very little, quote, personalized messaging. It feels kind of general anyway, not really worth the effort. So if you're going to do it, you got to go all in, right? And that goes back to Amanda now fighting with MLR to get it approved, because if you kind of water it down a little bit, to Sean's point, it's not going to yield anything. And now you spend all this time, and it's not just your time, it's agency time, it's a bunch of people's time. So the cost is financial in one regard, but I think it's more important on the time side, because you can get more money at some point, but you can't get more time, right? So
Yeah, I just was going to say that I think part of personalization can be the context also. So we've made an effort, at least in medical, this is more operationalized already on the commercial side, but to make sure that there's that 360 feedback loop. What insights are coming in? What have people seen of our content in the digital space? How is it resonating with them? Making sure the field knows that an HCP has engaged with our content on a platform, and then understanding the context of where they are in that learning journey it really resonates and improves engagement, but it's on, again, more of a manual scale right now. I mean, think of what we could do if it's operationalized across the organization.
So I'm just going to give a quick example of me as a consumer of tennis equipment, because that's my life now, so I'll be speaking at a fierce tennis conference later. So what I buy from an e-commerce site, and I bought a bunch of tennis sneakers that I ended up returning because the fit changed at Nike and all this. So what I was waiting for is somebody from the company to say, hey, we noticed you've bought like 10 pair of sneakers in the last month and returned 9 of them. And what's going on? Is there something? We have a shoe specialist who can help you. I mean, to me, that is personalization that I'm craving, because they're observing a behavior and they're offering a solution. It never happened. And I could, of course, I could contact them, but I want them to contact me. So, man, is there any thoughts on stuff like that you could have your analytics team look at, and that you could, because there isn't really an MLR issue. I mean, there's always an approval, but there's like, I'm just looking at how you've been behaving and trying to help you.
Yeah, I think what we've been focusing on more recently is getting that kind of voice of customer, getting that feedback loop back, right? So it's not only about the data signals and the actual engagements that our HCPs and our patients are engaging with our customers' medical sales, whoever it may be, but actually getting that feedback back, learning from that feedback, where are they struggling along the adoption journey? Where is the content not resonating? Right? Or what are they saying to our MSLs? Or what are they saying, to our reps at the end of the call? And getting that feedback and making sure it's a continuous loop. So actioning on that feedback and not just the data signals from like media or email or website.
So it's interesting, because I feel like I have a question for Amanda and Sean here combined. One of the things I realized I learned recently in research for a talk I gave a month ago, was there was a study from ZS that showed this is about physician behavior, that 85% of their behavior is influenced by the content produced by pharma. Great, that makes sense. That's why many of us are here. But only 60% of that data have data that's trackable, right? There's other content, direct mail, conferences, whatever, that shows no data trail. So when you look at data, there's gaps. So if you're just looking for people who respond, you're missing all the people who are influenced by that same content but don't do anything other than buy the product. So how do you account for that? How do you look for that? Because that goes into the whole triggered stuff, which is really hard when people don't give you anything to trigger off of.
I mean, I think from my perspective, it's just working with what you have, right? So it's about looking at, as I mentioned earlier, looking at the available data signals that we do have and where does it make sense, and then kind of filling the gaps where we need to.
So actually the question for Sean is, can AI help there to predict, okay, these people don't have any history, but they look a lot like those that do. Can you, and that's just a model too, but I mean, what do you think?
Yeah, I want to go back really quick too to demystify something that I think Amanda and Nana were hinting at, maybe for people who didn't or who don't do this on a daily basis, which would have been, they were talking about like the feedback loop and the 360 thing from sales reps. I'm going to wager, just to make sure everybody's on the same page, because if it's not your thing every day, or you don't do it. So when sales reps go and they can call on people, whether you use like IQVIA, OCE, all those calls are logged in a tablet, or Viva has one too. There's usually radio buttons that they can tag that say what was the content of what was discussed, and they can also leave unstructured text on what they maybe talked about. We log that stuff, and then that can be fed back to me to then figure out what they want to do. Sorry if that was like super patronizing, but I saw some people's faces kind of like a little bit on like, you guys can do that? Yeah, we can. And then we feed the content back and tailor the message differently, and that's the feedback loop. Cool. AI bit, I don't know. It's hard because you're just accounting for a bunch of stuff that isn't there, because we do work in pharma where we don't have a crazy 360 view. So like even Meta is walled, right? Meta, Instagram, Facebook. So like even that's like a walled thing where we can't see in exactly what people are doing and what they're doing. Because they don't share data across platforms. There's crazy big gaps, and then I personally just do the best humanly job I can, acknowledge the gaps, make sure people know the gaps, and then I move forward. I don't trust AI. I don't trust AI.
We can go one step further on that. That is not just the CRM and what we're getting from the campaigns, right? So we've seen several systems where we've got real-time feedback from the customers in congresses, for example. We've introduced, like, again, it's not AI. I would say it's algorithm-driven, not AI. So we've been able to collect meaningful data and then feed them back into a central platform with a lot more intelligence, right? So the CRM can do certain things, but then you want to actually decipher what real-time data is going to look like. So how can that be captured? Starting from how you capture that data to how you use that data, and then how you feed that back into a central repository, somebody like Sean's looking at, and then how that can drive meaningful interventions.
So Sean's introduced us to HI, right? Human intelligence. That's a good one. So to me, then, where you have the gaps in data, which can be significant parts of a customer segment, is it fair to say you have hypotheses as to, hey, these guys are more like these guys, or whatever the hypothesis is, that you can then put stuff in market to prove it or disprove it, right? Is that that's
in time, yes. Yeah. 100%.
Okay. A question more for Amanda, maybe Donna too, is how are your agencies involved in personalization? Are they part of it? Are they on the sidelines? You just tell them what to do. How do you engage your agencies?
I think the agencies love personalization because from their perspective, it's more assets and it's more money, if I'm being honest. No, but the agencies, I think bringing the agencies along early in the planning process, along with all of the other cross-functional partners, but I think at AZ, at least, it really starts with the brand. It starts with what the business objectives are. What do we want the customer to do? What do we need the patient to do? And so again, like, it's not like we have this one-size-fits-all approach to personalization. So it's going to vary brand by brand, agency by agency.
One-size-fits-all approach to personalization. That's interesting.
Like, you know what I mean?
Framework for it.
A framework,
I
right?
Totally understand.
A blanket.
Right.
But yeah, it's going to depend on the life cycle of the brand and particularly what we're trying to
So
do.
you're sort of dictating to the agencies,
Yeah.
we're doing this or we're not doing
Yep.
it. Because I always thought one of the benefits of agencies in any regard is their experience beyond your industry or your product category or whatever, that they can say, oh, in automotive we did this, and then we see how we can apply it. That is a pipe dream that almost never happens, right?
Yeah.
Yeah, and I would say that we've had good success in trying to work with vendor partnerships where we're actually delivering the information to see where we can innovate in order to deliver a program that is personalized to their audience. And so that's one way that we've been able to do it on the medical side, but that's only one channel. But within that channel, we can do a lot. And so we've started small, and then we would like to scale that beyond one channel.
Okay, so we have a minute 43, 42, 41 left. Any questions from the audience? Or is this so? Then we'll go to Michael.
I can be loud. I was excited to see that somebody from medical was on this panel talking about, and so maybe this isn't like, okay, so here's my question. When we talk about like user experience, one of the issues we're running up against is how do we handle this like compliantly when we talk about like the roles that medical plays versus commercial plays when we think about the customer experience. I'm curious if you've like addressed that issue in your organization. How do you navigate that? Not only about customer experience, but like the compliancy rules between medical and commercial is kind of like zones.
Yeah, it's a tough one. I wouldn't say that we're navigating it. The best practice for us was bringing governance and legal and even our marketing partners on the journey. This is what we're trying to do. We were able to create kind of medical-specific channels where we knew commercial wasn't going to be, and like own channels from the company. That's easier to do. But in spaces that are shared, we did establish SOPs and very strict guidances about what could be done and what couldn't. And we're always evaluating new use cases, I would say. So we created a forum that allowed us to effectively debate about what the appropriate approach was and what the right guardrails were. So it has been a journey, and it continues to evolve. But we have put official guidance in place about how these things should be managed. And then the partnerships across the functions, has been amazingly valuable, as you might expect. Right? We can talk after if you like, too.
And then adding to that, Donna, do you think that the framework will differ greatly for medical versus commercial as well as the personalization is concerned? Because I mentioned about having a certain higher degree of freedom as far as content is concerned for the medical versus commercial. How does that sort of influence your strategies?
It definitely, I mean, I do think that there's a different approach that we're taking on the medical side. It does often happen that we're on the same channel trying to reach the same healthcare professional, but often our approach is different.
Right.
And I do think there is an element of the personalization that is a little bit more about what is the patient experience rather than market share and things like that. And that drives a little bit different of a personalization approach where we're actually able to measure was there a behavior change in that doctor that actually enhanced patient care? And I think it's just when you have a different mindset starting out, that leads to different types of content, different types of.
So you have a slightly better runway in terms of how you would express the content, I would assume, right?
Well, we can get content approved faster, I would say. That's one of the things we've noticed.
That's what you can say versus what you cannot say.
To some extent, we always ensure that we're fair balanced and compliant with our SOPs. We ensure that this is a channel where we're actually meeting a healthcare professional, where we can have that almost peer-to-peer conversation. So we put those guidances in place to ensure that. At the end of the day, though, some of the channels we're using are shared with commercial, and therefore we're seen by FDA as a similar voice, and that limits what we can do in the similar way as marketing. But we found that those aren't as effective for medical anyway to be in those spaces. But we've tried it.
Okay, one more question.
Thanks, Jim. Sean, I love the fact that you pointed out that pretty much all the studies on personalization have been ineffective or have shown that it doesn't really work. So my question to the panel is, should we be more honest about how we define personalization versus customization and what it means? Because, sending an efficacy letter to somebody doesn't really mean anything. So when we also talk about the difference between customization versus personalization, should we also be more upfront about how we measure it, to Jim's point around how much time it takes to be personalized, how much effort it takes to be so-called personalized, because it's not actually going to return any positive impact on the business? Or am I wrong?
Well, first, I don't know if I fully indicted all of the measurement in the world, but if I did, interesting. I'll say actually when I was ranting a little bit earlier, level 2 from Allison, I said I was all in on level 2 when Allison was talking about cardiologists and nephrologists and customizing. Okay, they're very different groups of people. I'm all in there. Like, yeah, I mean, I would be totally cool with whatever word we want to use for it. If it's super different groups of people that we know are practicing very differently, 100%, I'm all for it. But like, I still am not, I don't know, this isn't maybe helping. I would appreciate people being much more upfront. My agency is the sponsor of this event. They want to segment things for next year and hyper-personalize them. And I'm like, why? Like, let's do like 2 or 3 big groups, and then like let's just start there and make it pretty straightforward and easy. Because otherwise we're gonna make like 15 groups with like slightly different. This one we're gonna start with the prepositional phrase first, and then go into the brand promise. And I'm like, whatever. So like, yeah, I would appreciate much more transparency from partners about this is what customization means. We're gonna do it at this level. We don't need to take it any further. And we're going to leave it there. That's my 2 cents.
So Simon, the clock has stopped. I guess that means we're done. So thank you guys for your inputs and opinions. Appreciate it. And thank you all.